Hello everyone, I am Dr. Preeti Sharma, Senior Consultant Pediatrician at KIMS Cuddles, Kondapur, Hyderabad. Today I will be discussing about the behavioral and emotional problems faced by children during this COVID-19 pandemic. Now in this pandemic, not just adults but we are seeing children having a lot of stress, anxiety, behavioral issues. Before we address the children, it is important that as parents, we keep our stress and our anxiety under check. Many people, many adults are feeling a sense of depression, anxiety. They are not able to cope up with the stress of the pandemic. Some have lost close family members. Before you focus on your child, please see that you are able to control your emotions. If required, please take a help. You can consult a psychologist or a psychiatrist to control your emotions first, because how we as parents feel, that reflects on our children as well. They will pick up on our signs of stress and anxiety. As for your stress and anxiety about the child, please don't worry too much about COVID in children. COVID in children is usually mild. It resolves itself in 2 to 3 days. Rarely, very rarely, there may be some complications which are easily treatable. So hope that will keep your stress and your anxiety in check. In older children, it is more easy to identify. You may find that the child is become very reclusive, does not interact much with anybody in the family, does not like to go and talk to friends if there are any friends in your apartment or nearby areas, is busy over the phone, continuously playing video games. There are sudden bursts of anger or crying or meltdowns. Some children may show stress and anxiety by overeating. They their boredom or their stress, they try to compensate by eating more. All these could be signs of stress and anxiety in slightly older children. A child who was not bedwetting, had good control over urine, suddenly starts bedwetting. A child suddenly starts thumb sucking, biting nails, things the child was not doing earlier. Please don't miss out on those cues. Talk to your child. If required, you can even take help from a child psychologist. For younger children, the signs may be more subtle. I am seeing the problem in children between 1 to 3 years. Parents are saying child is showing extreme signs of temper tantrums, does not listen to them at all. Children are not speaking much, not talking much. Children earlier who had in fact picked up on speech, 2.5 years old children. I have parents coming to me and saying that now they are not talking much. They have even stopped using the words which they were using earlier. Again, as I said, increased bedwetting, increased passing of urine, more accidents while passing urinating in the daytime as well. So watch out for these cues in young children and in older children as well. A big problem which is leading to more stress and anxiety and emotional problems in children is increased screen time. Parents, obviously because of their workload, their office hours, along with managing children and the household, are resorting to give them phones, tablets, TVs. This is making things worse. Children are not able to cope up with their emotions and they are getting addicted to these devices. So make a conscious effort to not let them get addicted to too much of screen. For children below 2 years, absolutely no screen time. Children between 2 years to 5 years, only 1 hour. Children above 5 years, maybe 2 hours on weekends you can allow. No video games whatsoever till 10 years of age. Video games are very addictive and have a very harmful effect on a child's brain. In fact, children who play these violent video games tend to be more aggressive, more irritable. So just watch out for these things in your children. What you can do is make sure that each parent spends time with the child individually as well. If you have 2 kids, then both the parents should separately spend time with each kid. Set out time for it. Maybe if the mother is spending 1 hour with the elder kid in the morning, she can spend 1 hour with the younger kid in the evening, or the father can spend some time in the afternoon or before dinner. So both the kids should have separate time, as well as make sure you have some family time. What is happening is, because of the COVID, being indoors, even outdoor activity is significantly impaired, and children need physical play, physical exercise to feel happy, to burn all that energy. Otherwise, their emotions will come out in aggression, anxiety, and stress. So maybe when there is less crowd outdoors, when there are less people around, you as a family can go out for cycling, you all can play cricket. If you are okay, some people, what they have done is they have formed their own social bubble. So maybe two families living close by, only they will interact with each other and not with anybody else. So if there is a family nearby who have kids of similar age, maybe you can start interacting with them, with the kids, so that they will have an outlet for their energy. If you are staying in a joint family with the grandparents, that gives you even a bigger advantage. You try to divide your child's time between yourself and the grandparents. Trust me, even the elderly are facing a lot of stress during this pandemic, and they would love to have some quality time with the grandkids. Maybe you can assign the grandfather that, okay, you will teach the child Hindi, or maybe you will make the child revise some maths tables, so that the child gets a set amount of time with the grandparents. The child can help out the grandparents for gardening, for certain cooking activities. Even to increase the family bonding, make sure you assign some housework to your child. During the pandemic, there are times when you get no house help because of the lockdowns intermittently. So you can give simple works. For younger kids, maybe you can just give them the job of, putting everything in place. For older kids, they can even help you with the dishes, loading the washing machine, loading the dishwasher, just a basic dusting. Trust me, this will make your child more independent and will help in the family bonding. It is important to identify all these signs and encourage outdoor physical activity whenever possible. Indoor play is definitely not safe with more kids, but outdoor play with masks and social distancing, the risk of getting COVID is very, very negligible. So you can use these measures to help your child have an outlet to his or her opinions, expressions, interacting with other kids. That is important. Many parents worry that how will I send my child to play outdoors? My child does not wear a mask, does not follow hand hygiene, does not do hand washing. Trust me, in children above 2 years, you can easily inculcate these habits. Make it a part of your family ritual that whenever you are coming in, going out, the child is washing his or her hands, child is using hand sanitizer, wearing a mask. With time, children do get used to it. For children younger than 2 years, since mask is not usually very comfortable for them, you can use certain face shields. There are very nice face shields available these days for appropriate age groups. With time, if you keep reinforcing this behavior, your child will start following these routines of COVID appropriate behavior. Don't worry about it. But if you will not follow it, I have, children see adults. If adults have pulled their mask down, then even children will feel, why should I put my mask up? So children usually, learn by seeing. So if you are doing the right behavior, they will also do that. Another thing which is important in this pandemic is to keep checking what your child knows about COVID. There are certain children who somehow, when you are seeing the news or when you are talking to your partner or to some adult, they may hear bits and pieces about somebody died, somebody lost a parent. That may put fear in their minds and you may not realize that it is happening. So every 4-5 days, just talk to them informally. So what do you think is happening? What do you know about coronavirus? Tell them it's a treatable thing, but we have to be very careful. Don't worry about it. And then your child may bring up, oh, mama, I heard that day you were talking to that auntie that her, somebody died. So then you can talk to them and explain to them. This is very, very important. Some children have developed this concept that if they step out because parents have kept them indoors for so long, now children have developed a phobia of stepping out. They feel that the moment they will step out, they will get coronavirus. If they get coronavirus, they will die. So these phobias and what they hear from the news, from your conversations, keep checking on it periodically. That will definitely reduce their stress. For children who are smart, who understand, children more than 5 years, 6 years, you can even tell them the truth. I'm not saying you should lie to them that nobody dies of coronavirus, but you explain it to them as nicely as possible that yes, it can be severe in some people, but there are a lot of treatments, but sometimes very rarely a person may get very sick. So put it across to them gently. And don't hide too many things. If you try to present a very rosy picture to an older child who's smart enough to understand, then the child will not trust you for information in the future. So hope these things help in coping up with the pandemic stress for children. Thank you.